Hey everybody, I am doing my project on metastatic lesions of the liver. And the only way that I could figure out to get me and my board in the picture was to sit on the floor. So, if it looks weird, that's why. Okay. Metastatic disease is a tumor that develops away from the side of the organ. And it's the most common form of neoplasm, which is any new growth that's benign or malignant of the liver. The most common sites are the colon, breast, and lung. And a lesion is a region in an organ or tissue that has suffered damage through injury or disease. The injuries could be a wound, an ulcer, an abscess, any kind of disease like a tumor, anything like that. Okay, anytime that a liver disease is suspected, the patient's asked to participate in liver function tests. And liver function tests are a group of lab tests that are established to analyze how well the liver does in normal and disease conditions. And in patients with known liver diseases, a number of lab tests are used to help in the diagnosis, including alanine aminotransferase, which is ALT, and that's slightly elevated with metastases, and bilirubin. They're indirect, direct, and total forms of that, and the direct and indirect are actually affected with metastases. And prothrombin time, it's prolonged with metastases. And there are albumins and globulins that are tested too. The clinical findings are abnormal lab tests, jaundice, hepatomegaly, weight loss, decreased appetite. And metastatic disease is the incidence of hepatic metastases, and they depend on the type of tumor and the stage of the initial detection. And the liver metastasis is a cancerous tumor that has spread to the liver from another place in the body. And it's also called secondary liver cancer. Primary liver cancer originates in the liver, and most of the time liver cancer is secondary. And the cancer cells that are found in the metastatic liver tumor are not true liver cells. They're the cells from the part of the body where the cancer actually began. And that could be either a cancerous colon, a cancerous breast, or a cancerous lung, or both lungs. The majority of the metastases arise from a primary colonic malignancy or hepatoma in patients with short survival rates after initial detection of liver metastases are those with hepatocellular carcinoma, and that's the most common primary malignant neoplasm, and carcinoma of the pancreas, stomach, and esophagus. And patients with a more prolonged survival time are those that present with head, neck, and colon carcinoma. Metastatic spread to the liver occurs as the tumor erodes the wall and travels through the lymphatic system or through the bloodstream to the portal vein or the hepatic artery in the liver. And it actually looks like this. And I don't know if you can see that very well because my printer didn't really cooperate with me. But it's a hypoechoic or an echogenic mass and diffuse distortion of a bullseye pattern. It can be solitary or multiple, and it can be well or ill-defined. And sonographic patterns of metastatic tumors that are in the liver actually vary. There could be so many different patterns, like none of them are all defined. And it's typical to have nodes throughout both lobes of the liver. And the following three patterns have been described: a well-defined hypoechoic mass, a well-defined echogenic mass, and diffuse distortion of the normal homogeneous parenchymal pattern without a focal mass. The hypovascular lesions produce hypoechoic patterns in the liver because of necrosis, which is death of the tissues, and ischemic, which are dead areas from neoplastic thrombosis, which are new blood clots. In most cases of hypervascular lesions correspond to hyperechoic patterns. And there are target types of metastases, or they can be called bullseye patterns, and they're the result of swelling around the tumor or necrosis or hemorrhage within the tumor. And as the nodules increase rapidly in size and outgrow their blood supply, central necrosis and hemorrhage may result. Various combinations of the patterns can be seen simultaneously in a patient with metastatic liver disease. And it could look like this. I don't know if you can see that one very well either, but there are cystic and complex masses in this liver. And the first abnormality is hepatomegaly, or alterations in the contour, especially on the lateral segment of the left lobe. And the lesions may be solitary or multiple. They can vary in size or shape, and they can have sharp or ill-defined margins. And the metastases can be extensive or they can be localized to produce an inhomogeneous parenchymal pattern. And there are actually stages of liver cancer, and the American Joint Committee on Cancer, which is the AJCC, has a TNM system, and it's the most widely accepted method for staging liver cancer. And this system bases the staging criteria on the evaluation of if it's a tumor, and it describes the number and the size of the original tumor. If it's a lymph node, and that indicates whether the cancer is present in nearby lymph nodes, and the metastasis, and that refers to whether the cancer has spread to other parts of the body. And the most common sites of liver cancer spread are the lungs and bones. And a number 0 through 4, or the letter X, is assigned to each factor. And a higher number indicates increasing severity. For instance, a T1 score is a lot less than a T2 score. And the letter X means the information just could not be accessed. And once the T, N, and M scores have been assigned, an overall liver cancer stage is assigned also. And there are multiple treatment options, but the ones that I found from cancercenter.org are interventional radiology, chemotherapy, radiation therapy, surgery, targeted therapy, or gastroenterology. And that's it.